In the rural town of Culpeper, Virginia, population 14,000, there's only one cardiology clinic that serves the community's cardiovascular needs.
Anything back here?
No, it's cardiovascular. It's Amy.
Dr. Zia Rashandal's practice provides essential care, including nuclear stress tests and echocardiograms, to an average of 30 patients per day.
Bend those knees for me.
Along with unlimited on-call and emergency room coverage at the local hospital.
In my practice, we have 12 employees, non-physician employees, and the practice has 3 physicians, including myself.
Like many small-town cardiology practices, Dr. Rashandal faces increasing operational costs that have forced the group to take measures to ensure the survival of the clinic. For example, the practice recently changed health insurance providers.
By renegotiating the health insurance with a different company, we saved $70,000. It was about survival because our practice still lives from paycheck to paycheck. I have seen in medicine and in a cardiology practice over years, our income goes down, but the expense goes up.
Struggling to make ends meet as it is, Dr. Rashandal's practice recently received word of an even harsher blow that could force them to close their doors altogether. 70 miles away in Washington, D.C., the Centers for Medicare and Medicaid Services has proposed payment cuts as drastic as 40% for cardiovascular services.
We did significant changes in order to survive last year before these cuts were even proposed. There is no margin for us, no room in this practice to accept or tolerate or survive another 10% cut. We are not even talking about 20 or 40% cut.
The closing of the Blue Ridge Cardiovascular Associates could have a devastating impact on the attached hospital. The closest hospital with cardiovascular specialists is nearly an hour away. 60 minutes too long for any patient requiring cardiac care.
After kind of going through that shock phase, I contacted ACC with an email to see what I can do. I contacted my legislator in Virginia and explained the situation in this small practice.
Dr. Rashandal is not alone. The most drastic of the proposed cuts affects echocardiography, which is set to receive a 42% reduction in payments should the rule go through. Currently, 90% of cardiologists use this core evaluation measure.
These changes are going to affect your practice, your ability to take care of your patients, and also to maintain a cardiovascular practice. So where you are doesn't matter, but you have to get involved. You have to call your legislator. Be involved, be informed, because not doing anything is not going to help any of us. And soon maybe it's too late.
If you feel lightheaded, if you feel like this...
We need every single voice. We need every single person to participate. Because if we said that somebody else is going to resolve our issue, it's not going to happen.